India is a land of paradoxes. Here we have the best in world healthcare on one hand, and on the other, there are millions who don't have access to the basics. This is one of the biggest challenges that India faces, and Kiran Mazumdar-Shaw, one of India's best-known entrepreneurs, tries to find the answers.
Hello and welcome to India's Healthcare Challenge with me, Kiran Mazumdar-Shaw. Today's guest is a man who is creating a new identity for our country. Nandan Nilekani, who heads the all-important Aadhaar program. Over the next 30 minutes, I will be brainstorming with Nandan to see how we can leverage the UID program to provide key building blocks on which to create a comprehensive healthcare system for India. Thanks Nandan for coming on this show and sharing your thoughts on how do we build a national healthcare system. You know, we have 1 billion plus people in terms of a population size, and we want to deliver healthcare for all. But where do we start?
I'll talk about the information systems for this gigantic project. I think what we're doing in the UID or the Aadhaar project is to give a unique number to every Indian resident. And that number is very important because that number is going to be unique and it will be biometrically authenticable on the network. So if you go somewhere and say, "Your Kiran, this is my number, this is my fingerprint," we'll confirm that you are that person. Then attached to that number, we can have the electronic health record of the person, and that record, and that's, I think, very important. The design of that record is very important. In today, for example, if you look at the US healthcare bill, you know, they're spending literally billions and billions of dollars on getting all their health systems to talk to each other. Hospitals, payers, payees, you know, pharmacies, all that. We don't need to reinvent that. We can build a fresh network, and that's why thinking through the interoperability is very important.
And I think that's why sort of, you know, this is a very important phase for all of us, you know, because this is the time when we are trying to sort of shape a new system, and this is where we have to make sure that we use technology in the best possible way to build a very efficient, optimal system.
Absolutely. I think at the same time, one thing very important in the health area is the privacy issue. Because, you know, if you have some ailment, you don't want somebody else to know. And that's where the Aadhaar helps, because Aadhaar has a biometric, you can only open it with your biometric. So the only key is your biometric. So somebody else can't access your health record. So we also handle the privacy part of it.
And you're almost kind of leapfrogging in terms of how you're building a new healthcare system. In fact, it's something that others would love to emulate. Because much as we talk about, you know, the healthcare systems in developed countries like, you know, the US and many European countries, we know that these are very inefficient when it comes to actually delivering healthcare to their citizens.
Absolutely. I think one is they have this whole legacy issue where they have this hodgepodge of systems which don't talk to each other, and a lot of people in the ecosystem have an interest in not sharing the data. Like a hospital may not want to share its hospital record so that they don't want to lose their, you know, customers and so forth. The other thing is that so this legacy issue is a big issue, and I think before the legacy issue set in here, we need to lay the parameters.
No, and you know, if you look at, you know, what this kind of a database allows you to do, and also the use of software technologies in mining all this data that we are going to be generating.
I think once you have this basic Aadhaar as the foundation for identity, you have the electronic health records. You can then, as the data flows to this system, you can extract information and intelligence from that. For example, if there's a sudden outbreak of some kind of epidemic in a particular area, you'll suddenly see a lot more cases popping up there. And then you know that you need to do something about that.
Yeah, so forecasting becomes very easy.
All kinds of things that you
But even, you know, apart from that, you know, Nandan, one of the biggest problems that we have in India is that we are a developing economy with the disease burden that is comparable to developed economies. Now you look at, you know, whether it's infectious diseases, which is the developing economy challenge, or the diabetes and lifestyle disease challenge that we have in terms of cardiovascular disease, cancer, you know, and of course diabetes. Now here I think again we need to be able to leverage all our skills in software, information technology and Aadhaar in seeing how we can do resource planning, how we can do forecasting, how we can mine this data to in a research oriented way to actually give us new clues about disease management.
Yeah, you know, you can have, for example, cancer registries where today what happens, often the same person goes to 3 different hospitals because they have something and they don't get the solution in one place, they try to go somewhere else. So those kind of things you can, this thing. Then you know, blood transfusion, another big area, because you want to tag that blood with and make sure that it's, you know, free of any disease.
And that you don't have to keep doing blood tests all the time.
Again, all that can be done. Then organ transplant registries. Again, you can create a national organ transplant registry, and then you can have whatever logic so that you can make sure that it goes to the right people. I mean, the umpteen things we can do.
Absolutely, and you know, I think that's where I think we would like to really look upon, you know, this whole sector, the software services sector, the information technology area, to see how we can actually leverage all these various technologies to integrate and build this very, very powerful system.
Sure.
And of course, we also know that there's a big challenge in India that today any form of quality healthcare is almost kind of confined to urban India, whereas rural India is almost devoid of any access to decent healthcare. So that's another big area we have to tackle.
Absolutely.
Through telemedicine, through many, many other aspects of technology.
Oh, absolutely. I think, for example, now there are a lot of diagnostic tools available at the tip, like using a mobile phone, you know, diagnostics, a wide variety of diagnostic tools. So if you can combine those diagnostic tools with the network, Aadhaar as the identifier, and have the data on the cloud, then the person at the point of service delivery need not be a doctor, it can be a paramedic, and they use these tools. So we can come up with a whole new thing. Is we have to think differently in the way we deliver these services.
For Kiran Mazumdar-Shaw, one of India's most famous women entrepreneurs, ensuring healthcare facilities for every Indian has been a passion. And as she sits down with the man behind the government's ambitious UID project, Nandan Nilekani, the question is, how can Aadhaar and the new trends in technology help access healthcare better?
Today, with all these new powerful technologies like cloud computing, where you can store your data in a very effective and affordable way.
The advantage of cloud computing is that you're mobile. I mean, like once my record is on the cloud and can only be opened with my biometric, then whether I go to hospital in Bangalore or Delhi or somewhere else, I can unlock my record and have it accessible.
But the most important aspect is how do we make sure that this medical network of hospitals that we have actually link into each other, share databases, and you know, that's where I think again Aadhaar can play a very important
role. And you know, I think governance is very important, because we must have rules on sharing. In other words, my record is not the ownership of one hospital. It's mine. It's my personal information, and therefore wherever I go, I should be able to get my personal information. What happens in some of these more developed countries is that the record is inside a hospital, and then you can't get it out, and you know, all those kind of issues. A couple of other things I just want to add, Kiran. One is immunization. Now, immunization is a big problem in India, because the number of fully immunized children varies anywhere from 30 to 70, 80%. Some states is as low as 35%. And part of the reason is there are no records, because immunization is something that happens over, say, 2 years. So you immunize, say, 2-3 times, and then the record is, the child moves somewhere, and the record remains. Now, if you put the immunization record on the cloud, then even if the baby is moving around, we can track it. So immunization is a very important benefit that.
Absolutely. This is a very, very important point that you have raised.
While technology and identity promise to resolve this fragmentation, another glaring challenge that our healthcare system is grappling with is the issue of medical insurance. Only 11% of the population has some form of insurance coverage, and the absence of an adequate insurance system just compounds the challenge.
The other aspect, of course, is about health insurance itself.
Oh,
you know,
yes.
We need to have a very strong national grid in terms of the insurance mechanisms.
Absolutely. You need portable products. I think again it comes to create portability, because a hospital should be able to get a patient from any insurance scheme. A patient should be able to buy any insurance policy. And you also want to have low-priced insurance, you know, like what
That's
we have
right.
done in Karnataka.
The micro health
Yeah.
insurance.
Now, for that, you need a network of places where I can pay small amounts of insurance premiums. So it's linked to the financial inclusion. So, you know, all these
So
things are
microfinance,
Yeah.
microinsurance,
Yeah, yeah.
all these need to be tied
Yeah.
up. I think it's
Yeah.
a huge challenge, but a huge opportunity
Should
as
be able
well.
to go to, in a village, a person paying 20 rupees a month should be able to get a decent health insurance policy.
And now that again brings me to another point, which is what is it that private sector can do? Because you know the private sector is also playing a very key role in this whole healthcare system.
Well, clearly, I mean, there are a lot of clear avenues. I mean, pharmaceutical manufacturing is clearly one, high-end hospitals, insurance companies. So we already have that happening. But at the same time, we have to look at the public health system, and we need to look at the whole concept of PHCs and, you know, ASHA workers and all that. So I think we have to have some way where they participate in the last mile distribution of healthcare, and then the feed-in happens into either a government hospital or a private hospital, and that insurance framework really helps you to go to either one. But the other thing, I think, where the government has to focus on public health issues. I mean, the notion of public health, that preventive health, I mean, better sanitation, better drinking water, better exercise.
Immunization.
These are all you can only do in the public space.
Nandan has been one of the pioneers of the IT industry, and this former Infosys stalwart, who is now spearheading the biggest government project, which promises to be a game changer for India, is optimistic about the potential of Aadhaar to propel the healthcare industry to new standards.
You know, Nandan, the whole Indian software sector has also played a very important role and is continuing to play a very important role in providing these back-end services for a number of parts of the international healthcare space.
Sure. Well, actually, it's more than that. I think it's not just back-end services. I think Indian companies have helped in helping many players in the healthcare ecosystem in the transformational initiatives. For example, most of the Indian firms have worked with the large pharmaceutical multinationals. They worked with the large hospital chains, HMOs. They worked with the large pharmaceutical chains. They worked with the large health insurance companies. So they actually have a fairly intimate understanding of how each of those sectors work. And I think that knowledge which is there in all these companies can actually be leveraged in this transformation that we want to do in the Indian context. So I think that's the other advantage we have.
Yeah, and you know, it's one thing about having a database, but the most important aspect is how do you manage that data.
Yeah.
So I think that's where I think Indian software companies have done a lot of data management for various parts of the healthcare system.
Yeah, and you know, for example, they are providing technology for clinical trials.
Exactly.
Then disease management, then supply chain of pharmaceutical companies. You know, all kinds of things which are relevant to what we're talking about.
And now, you know, coming to what's happening in our own healthcare ecosystem, you know, I think there are a number of very, very interesting initiatives, you know, the Arogya Shri program, the other healthcare programs, the RSBY program and many, many others. How do we again connect all the dots?
Absolutely. That's a very good point. I think when you look at recent health initiatives by government, there are some big moves, and one is clearly health insurance, and the Rajiv Arogya Shri, the RSBY are all Yashaswini are all examples of insurance. Then I think the National Rural Health Mission, I think is a very big program, and you know, the whole concept of ASHA workers who are now there in villages, who help the ANMs in performing the duties. That's a whole new sort of thing that has come in, and the whole ASHA worker management. And that also needs technology. For example, you want to make sure they get paid, for example, on incentives. If they bring a pregnant woman for delivery, they get an incentive. Now, how do you need to have underlying IT systems to manage.
And not just ASHA workers, you need to develop a whole bunch of technical skills in the rural areas.
Exactly.
You know, how even if you want to practice telemedicine, how do you, build these skills at the rural levels?
Yeah, you need to have these ANMs and ASHA workers trained in these technology-enabled devices, because they may just do some record some things using some diagnostic stuff, and that data may goes back to the central cloud and somebody there does the analysis. So all those things have to be built.
And when it comes to low-cost technology and devices for high-quality healthcare, The small mobile handset is a very potent device with a plethora of services on offer to improve the health ecosystem.
I think there's also the mobile, Kiran, because
That is
for example, I can have, if a chronic ailments, if I sign up for a program on diabetes or something, then actually I can use the mobile to communicate to the guy, send him reminders and all that stuff. So there's a whole low-cost medical delivery platform using mobile, where again I find a lot of innovation happening in India.
And I think that comes to the root point, which is really about the use of technology to have an inbuilt aspect of affordability,
Yeah.
which is what it's all about. You know, how do you deliver affordable healthcare using technology in a very innovative way?
Yeah, that's very important. And again, that's where I think we have a chance to leapfrog, because when you look at what's happening in the West, the healthcare costs have just gone 15-17% of GDP, and they have a lot of very expensive high-end equipment. We really can't apply that paradigm here. We have to have a completely different paradigm, which is low cost, at the same time innovation, at the same time it can be as effective as that.
Yeah, and that's what then gives you the hope that it's not a bridge too far, because technology can really bridge that gap.
No, I am convinced that all the pieces are now falling into place, and we can, in the next few years, if we can bring all this together, make a big impact on healthcare.
But you know what really worries me is, Nandan, these are wonderful ideas. You know, we are capable of ideating in a very exciting way. I think the important aspect of our national healthcare mission is going to be to then collate all these ideas, crystallize them, distill them, and put them into a kind of a very time-bound kind of planning process.
I think implementation is the key to
because that's going to be very important. Because otherwise it will all become very exciting, very innovative thoughts, and nothing.
And this is not easy stuff. As I said, the Obama recovery package had a $20 billion budget just for electronic health records.
Exactly.
And these are serious amounts of money they're spending. So it's not that we have to spend so much money. It's more getting all the players in the room to sort of agree to a common way of doing things.
So let's start with Aadhaar. Let's hope that we can use this as the first important building block.
Sure. Well, if we can give a number to every Indian, we can easily create a health record for everyone.
That's right. So let's hope that Aadhaar will become synonymous with our
Absolutely. Look forward to that. Thank you.